As we age, it is common to chalk up fatigue, shortness of breath, or feeling less active to just aging. But for some, these lingering symptoms, these annoying symptoms, or even the absence of symptoms, could actually signal a serious heart problem. Nearly 12 million Americans are living with heart valve disease. Yet 1 in 3 older adults don't even realize it. Heart Valve Disease Awareness Day is this Sunday, February 22nd. Let's say good morning to Dr. Mark Russo, Professor and Chief of Cardiac Surgery at Rutgers Robert Wood Johnson Medical School. Good morning, Dr. Russo.
Good morning to you.
I know that a lot of Americans don't even realize they have heart valve disease. A very dear friend of mine has mitral prolapse disorder. She didn't realize until she literally passed out as she stood up, and she was only in her late 20s. What findings stood out to you the most?
Well, as you mentioned, 12 million Americans have heart valve disease, and but about half of the people that we surveyed in a survey that we did of about 5,000 patients over the age of 65 didn't even know what heart valve failure was. And in that population of patients, though 90% of them recognize that screenings are important, less than 16% of patients, and these are patients, again, over 65 who are at the highest risk for heart valve disease, ever had a discussion about screening for heart valve disease with their doctor. Even more interesting to me actually was that for patients who had a family history, so again, another strong risk factor for having heart valve disease for themselves, 40% of those patients didn't talk to their doctor about being screened for heart valve disease.
I know that years ago, surgical replacements included things like using pig valves and whatnot, but we've advanced, right? So, what kind of advances do we have in this?
So we still do those things. I'm a heart surgeon, and traditional open heart surgery is still a great option for patients. We can do many of those procedures minimally invasively through a small incision. But over about the last 15 years, we've developed even less invasive therapies, catheter-based therapies, where we can make a puncture in the blood vessel in the leg, and we don't have to stop the heart. We don't remove the old valve. We're actually able to, in some cases, repair or replace the diseased valve, and those procedures are commonplace. Particularly TAVR, which is a treatment for aortic stenosis. That procedure has been done about 3 million times worldwide. So it's a great advance in therapy. For TAVR specifically, the procedure typically takes less than an hour, and about 90% of patients go home the following day, most saying they feel better almost right away.
It's insane. So the heart is actually still beating while you are working on one of the valves that's moving. That's just mind blowing. I'm sorry. It's just crazy to think about that. What are some warning signs that people just need to look out for? Is it just stress, fatigue, feeling a little lightheaded? What should they be looking out for?
Yeah, well, you had mentioned some of them earlier. Often it starts with a feeling of fatigue, some shortness of breath. As symptoms get more advanced, patients may have chest pain, or as you mentioned, you can even pass out from heart valve disease. But in many patients, there's actually no symptoms at all, or in other cases, patients have symptoms and they explain them away as they think they're getting older, they have other stressors in life, and so they don't recognize that it's heart valve disease that's causing those symptoms, because it can happen slowly over time, over the period of months or even years. And that's why it's so important that patients do get screened, because not every patient presents with symptoms or recognizes the symptoms that they do have.
Yeah. Now, it does run in my family as well. I have AFib. I've had to have 2 cardiac catheterizations, and they noticed the tiniest bit of a leak. Nothing to worry about. They said the tiniest bit of a leak. In my case, my brother has it as
Mhm.
well. So and my mother, I believe. So it runs in our family. It's genetic, clearly. Um, when should somebody seek treatment? Like if in the case of me, tiny leak it's not symptomatic. If it's not symptomatic, is that okay? And when should people get screened? If it runs in the family, should they automatically consider talking to their doctor about a screening?
I think that's a good start. So people who have a strong family history should be talking to their doctors, and certainly as people advance in age, patients again over 65 are at the highest risk. Those are two of the strongest risk factors, and really the screening is pretty simple. It's just having a discussion with your doctor. There's some pretty simple risk scores that can be done to assess the likelihood that people do have disease. if people do have disease, and just placing a stethoscope on the chest is a great start. That's typically how heart valve disease is diagnosed. Then you can go to more advanced ways, such as echo or cardiac CTs. But again, just having the conversation with your doctor, having them listen to your heart, really, that's where everyone should start.
And it's absolutely painless. Even a cardiac catheterization, it's nothing. So people are, oh, it's so scary. It is nothing, and you're just better off knowing and getting it taken care of
Yes.
than not knowing and potentially having a major issue. By the way, what role does lifestyle play in this?
Well, depending on the disease. So certainly having a more sedentary lifestyle puts you at higher risk. Smoking, no one should smoke, and that's not just cigarettes. That's vaping, cigars, whatever it is. Any type of smoking increases your risk of disease, diabetes. But for aortic stenosis, which is the most common form of heart valve disease, there's actually no modifiable risk factors. That is, there's nothing that patients did to cause aortic stenosis. It's just a disease of aging. So it can present, the risk can be a little bit different for different diseases, but if you have typical cardiac risk factors, then that puts you at higher risk. And as people get older, then that increases their risk.
Gotcha. Dr. Russo, is there a website people can go to check out more information?
Yeah, so if you go to screenheartvalvedisease.com, that will give you some information on heart valve disease. It'll give you a good screening tool that you can take to your doctor to help guide whatever additional testing that you might need to see if you do have disease. And I think it's a very helpful resource for people who are interested in this, which is really, again, anyone with a strong family history with cardiac risk factors or as people get older.
Dr. Mark Russo, Professor and Chief of Cardiac Surgery at Rutgers Robert Wood Johnson Medical School, the man who teaches people to treat people for this. Thank you for coming on this morning. Good to have you on. What an amazing
Talking
story.
about this important topic.